Hi, I'm Jeff Welch, CEO of Florida Medical Center, and I'm here today with Dr. Erik Beyer. Thank you for joining me today. What do you do at Florida Medical Center?
I'm the cardiothoracic surgeon here. I'm the chief of cardiothoracic surgery, and we do open heart surgery here. That's my job, is to do the open heart surgeries at the hospitals.
So during this crazy time of COVID-19, what types of cardiac symptoms require immediate ER response?
No question, if you're having chest pain, all the usual ones that we talk about. If you're having chest pain, severe chest pain, even mild chest pain with minimal exertion, you need to come in usually with an ambulance. If you're having shortness of breath with minimal exertion, you should be seen by a physician, no question about it.
Is there a concern about delaying? A lot of people have put off their elective cases because of their concern.
That's right. Yeah, we have not been doing elective cases in the last month or so, as mandated by the government. But what I've noticed is the people that are coming in, these are urgent and emergency cases, and they have been delaying coming in because they're worried about COVID, and that is the wrong thing to do, particularly in these situations. The people that are coming in are really pushing the envelope on their symptoms that I've noticed, that I've been operating on the last couple of weeks.
And what is the hospital's response to this? Is the hospital making sure that the quality is there and the safety is there?
Absolutely. That I feel very comfortable about. The people I've been operating on are completely separated from anybody that's got COVID, and none of the patients I've operated on in the past month and a half none of them have gotten COVID while being here, that's for sure. And so I think we're doing a really good job of keeping the patients separated, and we can't have a secondary effect of people dying from diseases that they shouldn't be dying from because they're worried about coming in because there's COVID patients. That should not be a concern of any of the patients.
So the governor on May 4th opened up elective cases, and he wanted to make sure that there wasn't continued delay of care. Have you seen a positive effect of that as of yet?
Not yet, but it's early, and I expect that next week we'll be seeing a positive effect of this. But again, I can't stress enough, if you've got heart disease and you die of heart disease and you didn't come in to get care, that's really a sad situation, because it should not happen that way. Nobody should be afraid to come into the hospital. We've got plenty of protective equipment, plenty of protective gear. We have a pathway for people that have COVID, and a pathway for our elective cases and people coming in through the emergency room, and that's important to understand.
Well, I want to thank you for everything you're doing. You are truly one of the heroes out there that are on the front lines. So is there a last comment you'd like to talk about?
And also, what we have to understand is heart disease is the #1 killer in the United States, and it trumps all other problems in the United States as far as health concerns are. And mortality rates from heart disease are #1 in the United States. We have to be aware of that and not delay your care because you're worried about a problem that is not going to be a problem at the hospital. We have to make sure people understand that.
Dr. Beyer, thank you for everything you do for the hospital, your patients. You truly are one of the heroes that are on the front lines, so we do appreciate it.
I appreciate it. Thanks, Jeff.
I'm Jeff Welch. Thank you.